Hi everyone, this is Aurelie Najm from the University of Glasgow, UK, reporting for RUM-Now at ULA 2021. Among all the very nice data that have been presented today, I wanted to highlight a few studies because I think that they're pretty relevant, but also they're exploring some aspects that have not been very much explored until now. And while there is a lot of interest in pregnancy in rheumatic diseases, and it's a key area of research, when it comes to men's fertility and the impact that rheumatic diseases could have, there's actually a very few reports. In that respect, the IFAME fertility study presented today in two oral presentations, OP0 to 11 and OP0 to 12 by Dr. Perez Garcia was very interesting. So it's basically a multi-center, cross-sectional, retrospective Dutch study. And they conducted the survey where they basically ask male patients about fertility and about if they were able to conceive and have children. And it's basically quite interesting to see that inflammatory arthritis do impact male fertility. So it's basically not true for every man. It's mostly true for men on whom the diagnosis of inflammatory arthritis has occurred during the peak of the male reproductive age. So men that were diagnosed below the age of 40 had a total and a mean total number of children which was reduced compared to both general population, but also compared to men that had a later diagnosis, that were diagnosed after the age of 41. And it was also the case for a lower fertility rate and a higher rate of involuntary childlessness. And in addition to that, men diagnosed below the age of 40 were more frequently evaluated for infertility. And so obviously that there can be a lot of causes for this observation, and this study was not exploring these aspects, but I kind of hope it's going to pave the way for further studies in that aspect. And in addition to that, they also looked into pregnancies from these males' partners, so who obviously don't have any inflammatory arthritis. But very interestingly, even after adjusting for maternal age and the year of pregnancy, they could show that these men's partners had a higher risk of miscarriage, but no other pregnancy complications. So I think overall there can be quite a lot of thoughts that can be given to this. It could be for biological reasons, psychological reasons, and probably a mix of that. And I'm pretty sure that in the upcoming years we're going to have much more information on that aspect. So that's what I wanted to share with you today. Stay tuned for more fascinating clinical data at ULA 2021 on rumnow.com and follow Aurelie Raimo on Twitter. Thank you.